Welcome to the Cornell Cooperative Extension Dairy Herd Health Troubleshooting Podcast, a podcast series focused on how to go about looking into health issues on a dairy. Each episode will discuss a different area on the dairy where herd health can be impacted. This series has less to do with providing answers to problems. We'll be talking about how to be more successful in your investigations.
Hi, everyone, and welcome to another one of our podcast episodes. My name is Havekes. I am one of the dairy management specialists on the North Country Regional Ag team. And with me today is Margaret Quaassdorff, who is also a dairy management specialist on the Northwest New York Dairy, Livestock, and Field Crops team. On this episode, we are going to troubleshoot transition cow issues. So it's important to recognize that all of these disorders are very likely connected. So on this episode, we're going to go through some of the risk factors, symptoms, diagnosis, and treatments of our most common issues. So before we kick it off, I just want to point out that while your fresh cow is going to be the cow that's experiencing all of these symptoms, it's important to realize that many of these issues go back to the dry period. So it's important and necessary to evaluate your dry cows and make changes there to prevent metabolic challenges in your fresh cows. For more on what you can do in the dry period, stay tuned for our upcoming episode being released on March 1st, where we're going to dive into how we can better manage cows in the dry period.
That's a good point, Casey. But going back to our fresh cow, the first thing we need to do is look at her overall appearance, take note of her temperature, her milk production, any rumen sounds, and look back at her calving record for clues when we're looking at ways to troubleshoot any issues. A cow running a fever above the normal 101.5 could indicate an infection somewhere in the body. In the summertime, when it's hot, you may also look for other clues because the cow's natural body temperature may be elevated due to heat stress. In cooler weather, though, 103 Fahrenheit would be something to take seriously. This could be a symptom of metritis, especially if the cow has an RP. A low temperature is usually associated with milk fever or hypocalcemia. Hey, Casey, can you tell us more about milk fever?
Yeah, absolutely. So milk fever is what we call a gateway disease, and it usually presents itself as a down cow with cold ears. So we call it a gateway disease because of the relationship it has with other metabolic diseases. They really are all connected in a web. And we're going to post a visual of this in the episode notes to help you visualize. But essentially, because low blood calcium is integral to all other transition cow diseases, for example, it can lead to reduced feed intake, poor rumen and intestine mobility, increased risk of displaced abomasum, reduced milk yield, increased susceptibility to infectious disease, and finally, increased risk of early lactation removal from the herd. We really need to make sure that we're doing everything we can to prevent it. But then secondly, we need to make sure that we're treating it appropriately so that we don't get a cascade of events that may follow. So when a cow becomes hypocalcemic, very simply, her blood calcium levels drop below an acceptable range, and she starts mobilizing calcium from bone and other body tissues. So if you're having a lot of milk fever issues, the first thing I would suggest in your troubleshooting attempts is to understand the risk factors, and this includes both at the cow level and the management level.
Wow. Okay, Casey, can you tell us a little more about those risk factors?
So at the cow level, we have age, breed, and body condition score. So one of the most commonly talked about risk factors is age, and that's because older cows have decreased ability to maintain calcium homeostasis. But other risk factors include breed. So you may have heard that Jerseys are more susceptible to hypocalcemia than Holsteins. And finally, we have body condition score, and that's because overconditioned cows are at greater risk, and this is partially because they have lower intake around the time of calving due to elevated leptin levels. And then at the management level, again, we have body condition score and pre-calving dietary management. So we're going to go more in depth on dry cow feeding during our dry cow episode. But basically, just try to make sure that cows are maintaining, not losing or gaining body condition during the dry period. And this is really going to help your post-calving metabolic health. So one of the most common or widely talked about risk factors or preventative measures, depending on how you look at it, is the diet cation-anion balance, or more commonly referred to as DCAD. And this incorporates two positive cations, sodium and potassium, and two negative anions, chloride and sulfur. And without getting into the nitty-gritty of it, the concept of feeding negative DCAD, so you have more anions than cations, creates a mild metabolic acidosis, and this essentially enhances the cow's natural physiological mechanism for maintaining normal blood calcium levels. And this is so that when she calves, her system is somewhat primed for the shifting calcium levels. So if you're already feeding this type of diet, but still having milk fever issues, it may be worthwhile to evaluate how efficient the diet is. And you can do this by testing urine pH levels. So when DCAD diets are fed properly, the resulting urine pH should be around 5.5 to 6.0. One of the reasons these diets sometimes fail is because cows may perceive anionic salts to be unpalatable. So if you have a diet that's easily sortable, cows may not actually be consuming the anionic diet that's intended for them. So there are two strategies right there to help you troubleshoot milk fever. Test your urine pH and look at the particle size and overall sortability of the diet. If something's off there, that might be leading to increased milk fever incidence. So another newer strategy is to feed a calcium binder. An example of this is a product called Exolite. And calcium binders work by binding calcium so that it's not available to the cow, which lowers her overall calcium level and triggers her natural hormone system to begin utilizing calcium from her bone and body reserves. And one last thing that can increase the risk of milk fever that you should pay attention to is the mineral level in your forages. Potassium and magnesium have a relationship with calcium such that their levels should be limited in the dry cow diet. For the sake of time, I'm not going to go into the physiology of how potassium and calcium interact, but if you are finding that you're experiencing a lot of milk fever issues, it's very much worthwhile to have your dry cow feed tested to make sure that the potassium levels aren't too high. So Margaret, what are some other things that we need to keep in mind while troubleshooting issues in our fresh cows?
Yeah, Casey, I'm so glad that you mentioned earlier that hypocalcemia or milk fever can be considered a gateway disease to some of these other issues that we see in our fresh cows. One of those issues is metritis, or inflammation of the uterus, which is usually caused by a bacterial infection and can be enhanced by different factors that lower the cow's ability to fight infection and properly contract the uterus. Like you mentioned, calcium is important for contracting muscles, which helps expel any residual fetal membranes and fluid from the uterus. When troubleshooting metritis, keep these things in mind. Clinical metritis is characterized by a fever with a cow that appears depressed and is off feed. But the most distinguishing characteristic is my least favorite thing, and that is a foul, fetid uterine discharge from the vulva. This stuff is nasty, and you don't have to be too close to smell it, and if you get it on your clothes, you will smell it all day. You'll most likely see this in the first 10 days post-calving, and it has resulted from a number of different scenarios that could be pulling a calf too early or in a rough manner, injury to the birth canal from a large calf coming through, dirty or rough-edged equipment, or even rings or jewelry on your hands or wrists that scratch the birth canal while you are assisting the calf. It's common after a dystocia birth or other calving traumas, twins or stillbirths, and is also associated with retained fetal membranes or placenta. It may be further complicated by stress and reduced feed intake or an imbalance of energy or minerals such as calcium or magnesium in the dry period. A cow with metritis like this will require antibiotic treatment and recommendations from your vet on whether it's helpful or not to perform a uterine lavage or to treat with other supportive therapies. And this brings us to our next issue to troubleshoot, and that's the retained fetal membranes, or more commonly known as retained placenta, which we mentioned as one of the other potential causes of metritis. A retained placenta is typically one that fails to be expelled within 24 hours post-calving. And cows that are low in calcium or have clinical milk fever have much higher incidences of retained placentas than those who don't get milk fever. This again has to do with the uterus's ability to contract and expel the fetal membranes. To better protect the health of the cow and her uterus and her future fertility, veterinarians typically recommend not to pull the cleanings out. Pulling on the membranes can permanently damage the uterine lining, and inserting your arm to try and assist it can also introduce more contaminant. Most vets say just to leave it alone and let the cow take care of it. If infection occurs, and you'll know this when she starts to get a fever and go off feed, and you'll start to smell that nasty, rotten smell, you'll need to interfere with antibiotic treatment and supportive care prescribed by your veterinarian. But the cleanings are so gross, I don't want to leave them out. I know, it's okay to trim them off, but let the cow release the cleanings when she's ready. Oxytocin temporarily helps the uterus to contract, but it doesn't necessarily help the placenta to detach, especially in the case of an aborted fetus or stillbirth. A retained placenta once in a while might have resulted from twins or a dystocia birth, like we said, or even a stillbirth or abortion. But if you start to see a higher incidence in your herd without one of the aforementioned reasons, it might be time to talk with your nutritionist about vitamin and mineral balances in your dry cows. So metritis and RPs are just some of the issues that follow milk fever. We know that ketosis is also one of those challenges. Casey, what are some of the things to watch for when we are troubleshooting ketosis?
Yeah, Margaret, that's a really great point. So because milk fever can depress intake, ketosis often follows. But that's not to say that ketosis doesn't present itself in the absence of milk fever. In fact, ketosis is very commonly present in the transition period without any other metabolic disease. So ketosis is essentially an energy problem, and it's caused by energy demand that exceeds energy supply, and this puts cows into a state of negative energy balance. While in this state, cows rely on body reserves for energy, which are often in the form of fatty acids. And when these fatty acids are mobilized, non-esterified fatty acids, or NEFA, are released. In large amounts, such as when the cow is experiencing very severe negative energy balance, the liver can be overwhelmed by the rapid influx of NEFA, and they're going to be partially oxidized into ketone bodies. So sometimes it can be hard to detect ketosis because these cows will keep cranking out milk. They're going to look like a champion, and they're not going to appear to be sick. And in fact, there's actually a lot of debate surrounding whether or not you should treat ketotic cows if they're not expressing clinical signs of disease. However, it's important to note that ketosis can quickly become a bigger issue if the cow goes off feed because it can lead to more severe problems like a displaced abomasum, and Margaret's going to touch on that a little bit later. I recently watched a live debate between Dr. Todd Duffield and Dr. Lance Baumgard on whether or not ketosis is a disease. And one of the important takeaways from the debate is what we should do about ketosis. So one of Dr. Duffield's point was to use ketone bodies as a tool to monitor and track transition cow success. Because even if ketosis is not a disease, at the very least, it's an indicator that the cow's experiencing impaired energy balance.
So how do we use ketones as a tool to monitor health?
Yeah, that's a great question, Margaret. So we can measure ketones either in the blood or in the milk. And in a perfect world, we would measure blood metabolites such as ketones in line in the parlor. And the reason for this is twofold. Number one, you don't want to make healthy cows worse by locking them up and taking their blood. And then secondly, BHB in the milk is more consistent throughout the day than blood is. And there's actually a lot of work being done right now by Heather Dan and colleagues out of Miner Institute using inline milk metabolites as a biomarker for ketosis and other transition diseases. And I think that research has some really promising results, and I'm excited to learn more as time goes on. But the reality is we don't live in a perfect world, and most of the time we're going to be testing with either blood or milk strips. And either way, there are two categories of ketosis testing. The first is at the individual cow level. So typically you're going to select a cow that's expressing clinical signs of disease. Maybe she has depressed intake, maybe her milk's dropping, or whatever the reason might be. You'll test her, and then you'll do it on a cow-to-cow basis and make your treatment decisions that way. The other type of testing is a herd-based monitoring system. So the goal in this case is to determine whether there's an underlying problem in your herd. And in this case, you would select a subpopulation of cows within a certain range of days in milk and then test them and routinely practice this to determine if there's any underlying ketosis in the herd. So regardless of the method, there's been a lot of debate about what threshold value you should use to deem a cow ketotic and treat her. Some researchers think that if she's milking fine and behaving fine and, acting like a champ, then there's no need to treat her. Whereas some other researchers believe that ketosis truly is a disease and that any signs of elevated ketones should be treated. A lot of people say that 1.2 is warrants treatment with propylene glycol, and others say 2.0 warrants treatment with propylene glycol. Regardless of how you do it, just make sure that you are giving those cows that additional energy if they require it. And you can also use vitamin B12 as a treatment for ketosis, and this has been shown to be increasingly beneficial when cows are also hypoglycemic. So if you're able to measure glucose levels on your cows, using vitamin B12 can also be an additional strategy. So, ketosis has been studied for several decades, and we still don't have all the answers to what we should do, how we should treat it. And I think that's just something to keep in mind going forward, that we're all still trying to learn. So there are management risk factors at both the cow and management level. And the management risk factors can be broken down to the dry period and the lactating period. So in the dry period, the management risk factors include pretty much anything that's going to stop the cow from eating as much as she wants, but also any opportunity that the cow has to increase body condition score is also going to increase her risk of developing ketosis. So when it comes to managing dry cows, we want to make sure that they have adequate stocking density, feed access. There's not going to be any competition, making sure that the cows have full cow comfort. And then also making sure that the pre-fresh diet isn't too high in energy. And then at the cow level, we have things like, once again, body condition score, but parity and genetics also play a role. So in times when you have high incidence of ketosis, you're going to need to troubleshoot both your management and cow risk factors. For the body condition score risk factor, look at what body condition score cows are drying off at and then calving in at. If they're gaining a bunch of body condition during the dry period, you're going to want to troubleshoot your dry cow ration. And we're going to go over details of that in our dry cow episode. So I mentioned that displaced abomasums are a more serious problem associated with ketosis. Margaret, can you tell us more about troubleshooting DAs?
Yeah, so one of the most serious challenges involved in this web of fresh cow disorders is the displaced abomasum, or DA. The abomasum typically rests on the floor of the abdomen of the cow, but it can become filled with gas, causing it to rise up out of place and going either to the left or right side of the body and possibly becoming twisted. When this happens, the entrance and exit to the abomasum are slightly kinked, which slows food passage and traps gas and fluid, which is not only uncomfortable for the cow, but detrimental to her health and milk production. So how do we know if our cow has a DA? Cows with a displaced abomasum stop ruminating and she goes off of feed. You can see this very clearly in herds that use rumination software to help track their cow health. And in addition, her milk production drops significantly and she has small amounts of very firm or very loose manure. And she's going to look pretty depressed. Her eyes will be sunken, and in my experience, cows with DAs tend to have like a fuzzy look, like all their hair is raised up. If you suspect a DA, you can use a stethoscope to confirm by listening while you firmly tap or flick the left side of the abdomen of the cow. What you're going to hear is a pinging noise, like the sound of a basketball bouncing on a floor. This is the noise from the gas buildup in the abomasum. A DA needs surgical correction by a veterinarian who will release the gas, reposition it, and tack the abomasum by suturing it to the body wall. Follow-up treatment may require antibiotics and supportive therapy on the farm's part. Prognosis is typically good if the surgery goes well, and it's rare that the cow will experience another DA. In your troubleshooting, if you suspect a DA but can't hear one on the left side, don't forget to check the right side. Most left DAs occur within 1 month after calving, and high-producing cows and older cows seem to be the most affected. Right DAs are rare but more life-threatening due to its tendency to twist on itself. They typically will occur in the first 90 days post-calving. So why do these even happen? It has to do with proper rumen motility and mechanics, which can be altered at the time of calving, especially due to changes in diet, and particularly those with higher concentrates, and also changes in feeding patterns. This altered physical rumen function and the feed change along with different feeding patterns allow that abomasum to fill with gas and allow it just enough room to slip out of place, causing the DA. Of course, displaced abomasums are also associated with all other fresh cow issues we've talked about so far. Casey, are there any other transition cow issues that producers should be aware of?
Yeah, so acidosis is one. However, it's not just a transition cow issue. It just becomes more serious in the transition period as they adjust from their pre-calving diet to the lactating diet. And acidosis occurs when the rumen pH falls below a level of 5.6 for more than 3 hours a day. And this is typically because of a large amount of rapidly fermentable carbohydrates being ingested quickly. Unfortunately, it can be challenging to actually diagnose acidosis in the herd because you would need a rumen pH probe or some type of measurement in order to actually see what the rumen pH is. But there are a lot of cow side observations that we can use to infer about acidosis. And one of these cow side tests include looking at the manure. So acidotic cows will sometimes have foamy or bubbly manure, and it may appear more like diarrhea compared to healthy cows. And this is because acidotic cows may experience hindgut fermentation that produces gases such as CO2. There may also be inconsistent manure in the pen. So this is a sign that cows are sorting, and some cows are getting more of the fine grain component relative to other cows getting more of the forage component. Another sign is that your components are inverted. So if your protein is higher than your butterfat, and this is because acidosis interferes with fat synthesis. So to prevent acidosis, it really comes down to good feeding management. You want to promote more frequent and smaller meals throughout the day rather than slug feeding, and this can be accomplished by increasing feed frequency or even by pushing up the feed more frequently. With more frequent feed push-ups, it's going to remove any existing sorting holes, and it could even reduce the variation in intake that you see within the herd. But probably the biggest preventative measure is to prevent sorting. And this can be done by ensuring that the particle size is small enough that cows don't have the opportunity to sort. So some work that was done about 10 years ago now demonstrated that very simply, cows are going to sort when they have the opportunity to do so. So we have to minimize any opportunity that cows are able to sort their diet. And historically, it was believed that you need to have long hay particles to stimulate rumination and for healthy rumen function. But more recently, we've learned that physically effective fiber doesn't have to come in the form of very long forage particles. You'd be surprised what would count as physically effective fiber. Even just a 1-inch chalk length provides enough for the cow to maintain a healthy rumen. And in my experience in the field looking at diets, it's almost always a matter of having too much long particles than not having enough. So you can easily look at how abundant the long forage particles are in your diet by asking your nutritionist or your local dairy specialist to do a Penn State particle separator analysis on your TMR. So Margaret, we talked about a lot of common issues, but there's one other disease that is less common, but still detrimental to overall cow health, and that's udder edema. We know that it can be very frustrating to deal with. So let's spend a minute talking about what we do know about this less common disease.
Yeah, so udder edema is the excessive accumulation of fluid in the extravascular spaces of the udder and surrounding tissues. The exact cause has not been identified, but it's more common in older first calf heifers and those who are overconditioned. So any heifers that had a hard time being bred and have gained a little bit of weight over the time before calving, these are the ones that you're going to want to watch out for. It may have to do with an improper sodium or potassium balance, but could also be a result of oxidative stress. Some veterinarians may recommend a diuretic to help reduce the fluid accumulation, but also working with your nutritionist and asking about the vitamin and mineral balances in your heifer diets could be beneficial to troubleshooting udder edema issues in your fresh cows as well. Casey, we've talked about a lot on this episode. What are some of our concluding thoughts?
Yeah, so I think it's really important to remember that when it comes to troubleshooting transition cow issues, they're all connected. So you can think of it like a spider web with hypocalcemia being in the middle of it. And we're going to put a resource in the episode notes for your reference so that you can see what we're talking about. But in summary, just be sure to recognize risk factors and make every attempt to reduce the risk of disease. Remember that milk production only occurs in the absence of stress, so we really need to minimize the stress that cows experience, especially during this vulnerable time. Thank you for tuning into this week's episode. Be sure to check out the next episode in the series and reach out to your local CCE Dairy Specialist or Pro Dairy for any further questions.
Thanks for listening to this herd health troubleshooting episode. You can find more episodes like this one on the CCE Dairy Educator channel on SoundCloud or on the Pro Dairy website, along with many other resources.